Well, it's a pleasure to be here and to bring you also this work from our department. The general purpose of this research was to evaluate the potential for cross-infection of X-ray cassettes or receivers or digital receivers, depending on how we want to call it. The specific purposes were to assess if there are significant differences between the amount of bacterial effectively present in the patient and the amount that the patient may pass to the receiver, if there are significant differences between the amount of bacteria effectively present in the patient and the amount passed to the receiver, and evaluate the types of bacteria that can develop in the culture media that we had available, that were SB for Streptococcus, Chapman for Staphylococcus, epidermidis and aureus, and the McConkey media for the Enterococcus and Proteus. The amount of bacteria present is evaluated by counting the colony-forming units in a 47 millimeter Petri dish. All samples after the collection were incubated during 42 hours at 36 degrees. This is a photograph of a colony-forming unit. Each dot is a colony-forming unit inside the Petri dish. So, to access the colony-forming units that may pass to the receiver, there were two steps. A sterile membrane were swabbed with the help of a sterile tweezer in the medial sternum, another in the epigastric region, and another in the interscapular zone of the patient. The sterile membrane was placed in a sterile 47 millimeter Petri dish with a non-selective media of soy tryptone and then incubated. So, non-selective because all the bacteria can proliferate in this. To access the colony-forming unit that passed to the receiver, 3 120 millimeter sterile Petri dish were placed in contact with the same zones as above. So the Petri dish touched those regions of the patient. Then this Petri dish was swabbed with a sterile membrane, and this sterile membrane was placed in a 47 millimeter Petri dish with also non-selective media and then incubated. To access the colony-forming unit effectively present in the patient, a sterile 47 millimeter Petri dish filled with selective media was placed in contact directly with the same zones of the patient, so the non-selective media touch the skin of the patient. After the analysis of the above, and to evaluate the types of bacteria, we use the selective medias, swabs in Petri dish, evaluating the colony-forming units that may pass to the receivers was done. These swabs were placed in selective media, SB, Chapman, and McConkey. As results, our sample was of only 7 patients, but it's quite difficult to have patients available during our collection because we had to carry all the material with us from the university to the radiology room. So it was difficult. Only patients, of course, we need authorization, and the patient should allow the permission and the collection. And of course, because it's in the work context, we have to deal with the pressure to produce X-rays, and this takes time. The mean number of colony-forming units were effectively present in the patient was 38.19. This value was used as reference for the CFU of the others that we will compare with. This was for normalization. And when compared the types of swab collection, the only significant difference was seen between the CFU present in the patient and the CFU that passed to the receiver. We applied the Brown-Forsyth test, and this was a really significant difference between these ones and the CFU that passed. The types of bacteria that were possible to evaluate because of the types of the selective media available were the SB media for evaluating the presence of Streptococcus, and we accounted with 15.7 CFU. The Chapman media where we accounted with 4.3 CFU for Staphylococcus epidermidis and 9.9 CFU for Staphylococcus aureus. The Maconchymediae presented an Enterococcus mean number of 2.29 and a Proteus mean number of 1.29 CFU. This research allowed to verify that there is significant difference between the colony-forming units effectively present in the patient and the amount that the patient is able to pass to the receiver, and there was no significant difference between the first ones and the amount that the patient may pass to the image receiver. The bacterial charge from the patient will not pass entirely to the receiver, and it is indeed considerably lower. And also the main type of bacteria present in this research was Streptococcus, followed by Staphylococcus aureus and epidermidis. The lowest CFU was Enterococcus Proteus. Thank you for your attention.